Let's go straight to the front of The Age and the Sydney Morning Herald. We'll have a look at the health implications of the coronavirus. Then we'll have a look at the economic implications of this particular virus, and then we'll have a look at the impact on sport. And if we have a look at The Age, you can see there fears 150,000 may die. Up to 150,000 Australians could die from the coronavirus under the federal government's worst case scenario as it considers advice on restricting visits to pubs, cinemas and aged care homes. Deputy Chief Medical Officer Paul Kelly said yesterday that the number of infections would be somewhere in the range of 20% to 60% of the population, urging the public to comply with social distancing measures such as avoiding large gatherings of 500 or more people. This is an infectious disease, Professor Kelly said. The more we can do to separate people and stop the disease spreading, the better. The death rate is around 1%. You can do the maths. Scott Emerson, they're really confronting and challenging figures, I've got to say.
I think many people will be very shocked when they see this headline tomorrow. The idea that 150,000 Australians could be killed, to die as a result of coronavirus, I think will shock people. They understand that this is affecting their lives. They understand that, Peter, that they are there is exposure out there. But I think the grim reality is that no one in our lifetimes has experienced something like this. We're going back to the Spanish flu after World War I to really look at something that has hit us in this way. And unfortunately, confrontingly, challengingly and sadly, we will lose our loved ones in some form or another. I don't think anyone is going to be spared in terms of seeing some member of their family or friends losing their lives as part of this.
Caleb?
This is obviously the worst case scenario. We don't need to think that this is what is going to happen. If you look to China at the moment, where they seem to have peaked and they're now on the decline, their cases are actually going down day on day compared to a month ago where it was going up and up. And of course the rest of the world is now starting to go up and up. We're catching up with them. But they've so far had about 3,300 deaths in China, and their instances are now on the decline. So I very much doubt that we'll have 150,000 people die in Australia, but these are the situations that we need to prepare for, because we are looking at a disease that spreads very rapidly, and as we've seen in Italy and around the world, countries where this was not taken seriously, the threat of coronavirus was dismissed, you end up in situations where there are not enough respirators and there is simply not enough treatment for people who have the disease. That's the situation that we want to avoid. And if we do end up in that situation, then it is entirely conceivable that we could have mass numbers of deaths, thousands and thousands of them. But I think, look, it took us a while to get there, but we're starting to react. We are starting to do things about it, and I think we should be able to avoid the big numbers that we're talking about here.